I have your concurrence on this matter. Thank you very much. I knew the answer. You know, in politics, you don't ask a question you don't know the answer, because you could get into trouble. So, if we can expedite, that exercise and make it sooner rather than later, we're also going to agree on how we are going to treat the indigents. There will be those that will be paid for, and you know, every person will have a rate depending on their income. There will be those who will be at the base, which is 300 shillings. There will be those at 400. There will be those at 500, like that continuously. So we will work with you in that process. Then the second thing I want to bring to your attention, and as I do so, to ask for your leadership as county governors. You know that primary health at level 2 in our dispensaries, in our health centers, and in our level 4s, the ones that provide outpatient service. You know very well that that service is available for free for every Kenyan who is registered in SHA. Let me repeat this. Every Kenyan who is registered in SHA should go to hospital in level 2, in our dispensaries, that's level 2, in our health centers at level 3, in our sub-county hospitals in level 4, be treated, be given medicine, and they should go home without paying anybody anything. That is the position. Because we have provided money as the government of Kenya. In this year's budget, we have provided 13 billion shillings that will be paid for every service that is given by every facility in Kenya. There are facilities, and I want to ask for your leadership on this. There are facilities in our counties that charge citizens in health centers, dispensaries, in sub-county hospitals. They charge citizens for treatment or medicine, when actually that and the medicine is already paid for by the government of Kenya. It is not acceptable. So, please, I don't want to mention counties by name because they are there. I just want to ask you that please instruct your CECs and your directors accordingly, so that instead of charging citizens, they should instead use the claim framework and claim for any service that they provide. Because that way, we insulate Kenyans, especially the people who cannot afford, from unnecessary harassment for medical services that they seek in our facilities. Let me also say the following. We have equally provided for money, 8 billion shillings, for emergency and critical care fund. Any accident that happens anywhere in Kenya, those who are taken to hospital, we now have a fund that we can use to make sure that they are attended to. And we again want to ask for your leadership so that we can ensure that these benefits accrue to the people of Kenya in the manner in which me and you have designed it to be. This will go a long way in making sure that we insulate the public from costs that make them sometimes even not go to hospital because they are not sure whether if they ask for money, if they are asked for money, they can be able to pay. Let me also say the following. We have now configured the system so that you not only provide the service, but there is also money in the SHA portal for commodities. And when you claim for the service and also claim for the medicine, because it is all in one package. That way, Madam Wangangi here will be able to sort out all our claims. I wanted to use this forum to seek your support in making sure that we roll out efficiently, effectively, and in an accountable manner this service that we co-designed together. Let me conclude by calling on all of us, my team at the Ministry of Health, all governors, health officials, private partners, and frontline workers to own this project, install the equipment promptly, use it effectively, and ensure continuous maintenance. And let me also say that as we do this, again, together, we must appreciate that health is a shared responsibility, and only through unity and commitment and vigilance will we unlock the full potential and promise of this National Equipment Service project. I will be looking forward shortly to the engagement so that we can deal with the Kenyans who cannot afford the indigents. I think that is a matter that is urgent to all of us. And also to ensure that as we roll out this program, we do not allow fraudsters and people who do not mean well to take advantage of the system, or even those who know what is right and they want to do the wrong things by charging citizens for a service that is already paid for by the government of Kenya. They also do not succeed, because our collective success is the success of our country. And let me say this, the success we are all looking for is not the success of a person. It is not the success of the governor. It's not the success of the president or the health officials or the minister. It is the success of Kenya. Because if we can be able to provide good quality, accessible health to all our citizens, we can be able to take this country to the future faster, much more efficiently, and collectively. So thank you very much, ladies and gentlemen, for listening to me. And I will be coming down to the counties. And there was something that was mentioned about the obsolete equipment, not obsolete, the former equipment of some of them, actually, majority are obsolete. And my good friend Onesmus here said that they are causing a jam. You cannot install the new equipment because the old equipment is still in that space. I have agreed with the vendors that as they come with the new equipment, they will assist you as counties to remove the old equipment. You know? And all you need to do is to provide some storage for them. We can lock them up somewhere as we, I don't know, is there still any conversation on this old equipment? There are people who still want to have a conversation with the old equipment. And mi nilijiondoa zamani kwa hiyo maneno ya old equipment. Sasa nyinyi kama mnataka kuendelea kuongea, hiyo ni mazungumzo baada ya mambo ingine, lakini mimi tulimalizana, si ndio? Huyu ngati hawezi kubali, lakini tulimalizana. So wacha kila mtu sasa ajipange vile atajipanga. The story is with who? Haya shauri yao sasa. Sasa vendors mtajipanga. Wajipange. So otherwise mimi nimeshukuru sana. Thank you very much for finding time for us to do this again together. I know you have requested that we should expedite the delivery of the equipment, and our manufacturers and vendors are here. Expedite. That is the request from the counties. Expedite the delivery of the equipment, and Waziri, you have my instruction. Any manufacturer or vendor who has not delivered or is behind schedule, give them a warning letter. If not, we will move on to the next supplier so that we expedite the process. I know also some mention has been made of the level 2 and level 3 equipment. I think we are also agreed on something called framework. The one you are supposed to pay, I was offering to pay 30% and you pay 70% over 5 years. No, that is not the agreement. No. You know, you want to shortchange me now. That is not the agreement. I remember very well. And you know, this is what I said, that I will pay the 30% upfront, but you will pay the 70% over 5 years. You know, it's a very fair deal. And you see, I don't have to. It is your equipment. I'm just helping because no. First, these ladies should not be talking because it is very difficult to argue with the ladies. They use intimidation. So we will, I think we made a deal. If there is need to negotiate that deal, let's have another conversation. Nyuma ya tent. Tutaenda huko nyuma ya tent, tutaenda kuongea how we need to do that. But my instructions to the ministry is that framework agreement, if it is not moving in the manner in which we agreed, let us re-advertise if necessary. So that, because I want also, because as has been said here, there are conditions like cancer that we need to attend to at the very earliest possible time. Yeah, so again, we should be able to do that. Is that okay, Bwana PS? Yeah, so again, I know there is a team which normally works collaboratively between the ministry and the council. If you can engage, and then we see how to take that forward. Otherwise, I cannot find a better way of collaboration than what I see between the Council of Governors and the government of Kenya at the national level. I mean, it just points to leadership. We all know that we are serving the people of Kenya. It is not who gets credit. And for me, I am not interested in credit. Everybody should take all the credit. Whoever wants credit should have it. But let us just do the program. I think that should. So let's do this together. So please, my team at the Ministry of Health, let us expedite. Your Waziri and your two PSS, please, we expedite. I think that is the language we are getting from the Council of Governors. Let me also say that you have my commitment on making sure that we deliver on health commodities as well. bado tuko na mazungumzo kidogo kuhusu KEMSA. As I told you, we have provided additional financial infrastructure for KEMSA. We must move the refill rate from 40% to 100%. We must do it. And we must do it in the next 3 months. It must be 100%. No citizen should go to any facility and fail to get medicine. Because you all understand, tukiongea na wananchi kwa baraza, tukisema tu hospitali, wanasema hakuna dawa. Si ni kweli? So this hakuna dawa thing, we must deal with it. And I have given very clear and very firm instructions to KEMSA. The CEO is here. You know what stands between you and your job. I have told him. Sijamwambia mambo ni matatu, lakini I have told him something. I have told him something. So, my good friend Wako, yeah, the refill rate must be 100% in the next 90 days. You have all, I have given you all you need. And Waziri has given you the support, all the support you need. The board has given you all the support you need. And these county governors, their first port of call when they are looking for medicine is KEMSA. So don't let them down. You know? And you are paying your debt, yeah, to that place. But we just need to agree, we just need to agree that the same way we are agreeing that let us pay for this equipment without going through hoops and jumping, you know, hoops and corners. Let us also see how we are going to, and I know there is a present engagement to see to it that we pay KEMSA using SHA. We agree on what kind of agreement that needs to be put in place. Chair Emeritus, umesikia hiyo nimesema? So thank you very much. Let me also say the following. Sorry, you know, the older you get, the more stories, many things you remember. You know, many governors had asked me about matters to do with bursaries. You know, I know you now know that we have provided a framework agreement which we have signed, and because the same way we are working together in health, we are also working together in education. You know, education may be a national government function, but we realize the importance of counties and the role they play in making sure that access is made possible to students who otherwise their parents and financial status could not support. And that is why we have signed the framework agreement, and all of you now can give out bursaries for all our students in all levels of our education. Again, it points to cooperation and collaboration as the Constitution mandates us to do. And I must say thank you very much for what you're doing. Asante sana. Yes, Governor says.
We also have a problem with the conditional grants, Your Excellency.
Yes.
The amount we are expecting before the year closed, we only given 10% of what we were expecting. And then we were told in the new financial year, we will get the balance of the last financial year and still get for this financial year. But the information we have, especially from agriculture, is that they are not